It's a system for an effective morning huddle. Now, I know some of you are rolling your eyes and saying, I used to do a morning huddle and we couldn't get it to work and we just kind of let it go by the wayside. Well, I'm going to frame it this way, Naren. This is my 30 year in dentistry. I've made it my life's work to study world-class practices. This is part of my daily routine, studying world-class practices. What do they do? What do they do? How can that be applied? How can that be adapted? And Aaron, in 43 years, I've met many world-class practices, and I've yet to meet a world-class practice that wasn't doing their format for an effective morning huddle. I've never seen that. Now, I have to use absolutes very carefully. Always and never have to be used carefully, because rarely is something always, or rarely is something never. But I have never seen a world-class practice that's getting world-class results not doing a morning huddle. Now, there's not one way to do a morning huddle. If you go back and listen to the podcast episode around the 24 systems, you'll hear me talk about a format for doing the morning huddle. There's not one way to do it. It can be adapted to suit your practice, but I'll give you some guidelines as you're designing your morning huddle. It needs to be no longer than 10 minutes, ideally 7. So there's a guideline. No longer than 10 minutes, ideally 7. Secondly, everybody needs to attend. Everybody needs to attend. You need your team to be present, because invariably Murphy's Law will kick in. If a team member isn't there, something will be talked about in the morning huddle they need to know about, and then they aren't in sync with what's happening during the day. So ideally, everyone should attend. There can be some exceptions to that, but ideally we'd like as many people as possible to be there. A third fundamental principle when you're designing your morning huddle is it should be more about the people you're seeing today than the processes you're doing today on those patients. It's more about the people that you're seeing than the process of what we're doing for procedures. And the fourth guideline that I would give you is it's all about identifying the bottlenecks in the day. You can see them clearly looking at the schedule. It's just, they'll be plain as can be. And you identify the bottlenecks and you figure out your way as a team to work through those bottlenecks so that we can maintain a smooth flowing day. And the last guideline that I say, a morning huddle needs to finish with some kind of intention to rally everyone together with some kind of intention about the day. And I happen to think that the very best way to do that is to finish the day. Imagine this, doctor. Imagine you have your schedule, being shown on a 60-inch flat screen monitor up on the, in your team room. You say, okay, everyone, I want everyone to look at the patients we're seeing today. And I want to hear nominations for this question I'm going to ask you. Whose life are we going to change today? And everyone take a look. Based on the people we're seeing today, whose life are we going to change today? Could be something we're doing clinically. Maybe we're going to seed a beautiful cosmetic case. Could be something we're doing behaviorally. Maybe we have a patient that needs some extra love and support because of some hardship they've been experiencing recently. Maybe it's going to be a celebration. Maybe we have a patient on our schedule today, and she's about to celebrate her 25th wedding anniversary. And we choose to celebrate that with her and really make a big deal about congratulations coming up. Or maybe we have a patient that just, competed in a local half marathon and they finished the race. And we're going to celebrate the fact that they finished the race. So finish that morning huddle by saying, guys, I want everyone to look up at the schedule, look at who we're seeing today, and let's nominate whose life are we going to change today? Now think about that, Naren. Most practices work about 200 days a year, on average.
Yes.
Business days, 4 days a week, about 50 weeks a year. And if you do that, if you picked a patient every day of whose life you're going to change at the end of the year, you've impacted 200 patients' lives. Could that make a difference in your practice?
100%.
I absolutely think so.
Yeah, I think this particular tip has helped quite a few practices. I think a lot of people who get into dentistry, especially team members, get in because they want to change, make a difference, right? This kind of sets the tone every day. And it's almost like it makes them like remind themselves why they do what they do.